Dr. Guleria, my first question is about how will the Indian administration identify who will be amongst the first people to get the vaccine shot? It's understood that the old, the aged, those with comorbidities will be the first ones to get it. But amongst that general grouping, how do you identify who goes first?
So there will be broadly three groups which are the priority groups. The first group is of course the healthcare workers, which is around 1 crore, the frontline workers, which will be around 2 crores, and around 26 crores of the people over the age of 50. So now, like you said, as far as the healthcare workers are concerned, it will be easy to identify because the data is already there with the government from various hospitals, both in the government and private sector, at the central level and at the state level. So once the doses are available, they will be distributed to various centers, which will be hospitals or primary health center based, and based on what is uploaded onto the CoWIN app, people will be given an appointment. This could be done on a random basis, and they would be asked to come for their vaccination at a given time. A time slot will be there, because remember, after the vaccination, people have to wait for half an hour just to observe for any side effects. And one issue would be that we don't want that they should be crowding. Physical distancing has to be maintained. So that will be done in a systematic manner. As far as the elderly are concerned, this would be based on the data that we have as far as the voting census is concerned. And the first group would be people above the age of 60, followed by people between the age of 50 to 60. And here again, based on the data uploaded onto the CoWIN app, and depending on the number of doses available, people at that place, in a systematic manner, appointments will be given to people depending on the number of batches and the number of sites one can have at a given place.
So you're essentially saying that unless you've registered on the CoWIN app and unless you have a prior appointment, you can't just show up at one of the vaccine centers. Because my question was, how do you avoid overcrowding? Because this message going across is also a time-consuming process. People hear, okay, mere mohalle mein mil rahi hai vaccine, and then all the people start queuing up over there. How do we ensure that it actually happens in a systematic fashion, Dr. Guleria?
Correct. Because if I may just add, we must also remember, unlike voting, here you have to, the adequate doses of the vaccine have to be available at that center. So if you people just show up and you have only, let's say you have only 100 doses and 500 people show up, it will not be possible to vaccinate all 500 people. So it has to be done using the digital platform where we know how many people are going to come on a particular day. They are informed and that many doses are available. It would not also be right that we have, say, let's say 100 or 200 doses, only 50 people show up. Then that will also have an issue of misuse or doses not being used properly.
No, so I was at one of the pharma companies last week, and what I saw was that several of these vaccine vials are being manufactured and filled over there. However, how do you keep track? My question is, how do you ensure that vials don't go missing, that there is black marketing, that those with pull and jugaad and pressure find some way of saying, okay, healthcare workers wait, army, air force wait, police wait, mera pehle laga do. How do you prevent that?
So all the batches of the vaccine which are given to, whether it be the main storage site or the state cold storage site, or it goes subsequently down, will be recorded. The number of each vaccine vial will be there, and the number of doses to be given will be checked. And one of the advantages of the app is that once it's given, the data is uploaded, you get a unique health ID creation. So we know exactly who's got it. Because the other important thing to remember is that then this person has to get the second dose also after 28 days. So it's very important that the unique health ID card is created by the CoWIN app, and subsequently the date for the second dose is also sent to him through an SMS message, so that there is no sort of missing of the second dose. And finally, a QR code based vaccination certificate will be issued to all after all the doses have been given, so that this becomes some sort of a certificate that this person can show later on that he has been vaccinated and therefore is safe.